On 6 News, results from a local study on ways that we can protect ourselves during periods of excessive heat. Our Marlo Lundak breaks down the information for us.
Last summer, UNMC hosted a study hoping to identify the hottest parts of Omaha.
In areas that are more industrialized, more asphalt, more concrete, those areas, some of those areas were almost 10 degrees warmer than areas that were more covered with trees and vegetation.
Those are spots like downtown Omaha, or areas of the city that were historically redlined. Jesse Bell, a professor in the College of Public Health, says just finding those hot spots isn't where this study ends.
We've identified areas in the city that are more vulnerable based off of at-risk populations and urban conditions that are potentially people more at risk. And now we've identified that, we can overlay the temperature information that we've received to basically see, are the places that are hottest also the places where we have the most at-risk populations.
The data gathered around Omaha can now be used to identify where mitigation efforts should go. Things like cooling centers or shaded bus stops, or where more trees need to be planted.
So it's not just doing science for science sake, but this is actually making sure that it actually gets to the people and decision makers that can make a change within our communities.
And Bell says change is needed to help the vast number of people who are most at risk when it comes to heat-related illness.
Outdoor workers, the elderly, low-income populations, people of color, communities of color. And there's a variety of different reasons for that. Pre-existing health conditions, where they live, lack of access to care.
He says following the study, a group including the city, National Weather Service, nonprofits, and local public health departments has been formed to implement solutions.
If we're not doing the things that are necessary to make sure that we have stronger, more protected communities, the potential for more health outcomes, negative health outcomes, only increases over time.
On your site in Omaha, Marlo Lundak, 6 News.